Well, let's head straight over to our public health expert, Dr. Bharat Pankania, who is, as ever, here to answer your questions that you've sent to us. Thank you for those. And lovely to see you, Doctor, as well.
Hello.
Let's pick up, first of all, on those do not resuscitate forms. So they can be alarming, can't they, for anybody to hear about, whatever age or health condition you might have. But you've always said that it's really important that we have these kind of discussions.
Yes, we should. And I think it is our British reserve that we don't talk a lot about certain important things. So to share with you, I am an Indian and I'm British, but I talk about these things to my children. So my daughter is 15 and my little boy is 12, and I openly talk to them about what daddy would want. And I've been very energized and exercised with family members not being present when you are gravely ill. So I had that conversation with them. So similarly with do not resuscitate forms, I want our viewers, our listeners, our readers to be assured it doesn't mean we will let you just die. It just means that you're giving us consent not to excessively try if there is very little hope of getting you back. That conversation and that understanding is important.
That's really important, actually, and very reassuring as well. As ever, you kind of cut to the quick with that. Chloe was asking at the end of that report as well how long this is going to go on for. She feels like she can cope with it if she has an idea.
It is better to not dwell on how long, but it is better to dwell on, will we get out of this alive and well and resurface and restructure our lives? We don't know, and it is better to say, look, let's take it a week at a time and see where we go. We have no medicines, we have no vaccines, and the only thing we can do is social distancing, and we hope that somehow we find a solution to allow us to return back to our lives. And one of the solutions may be that life has changed for a long time in a different direction. Again, for that, we prepare for it.
I think that's a good way of looking at it. Focus on the things you can control as well, isn't it? And actually, a lot of people had asked about whether we would have to isolate until a vaccine is found. Is that what you think will be the case then?
Well, I think what we will do is when the virus is in low count, meaning not widespread in circulation, we will be out and about, but exercising, distancing, maybe wearing masks in crowded places and being very, very careful to keep a low profile. I think that's the new normal that I envisage in the coming months.
Okay. We've had a letter here, because of course not everybody is on email, from Mrs. Reynolds. Thank you so much for that. Saying, should all key workers be tested, as those who are asymptomatic could still be spreading it?
Yes, but we need to test, and not only test, but we need to contact trace. Testing on its own is not very good control methods. So of course we test, especially if we suspect that somebody may have signs and symptoms of illness, because we don't want these people to be infected, infectious, and working in a clinical area. So yes, they should be tested.
Okay. Carlos talks about the graphs that are showing low numbers, especially in the southwest, and he's saying he's worried, are we still waiting for the peak here in the west?
Invariably, the virus will come when we have excessive movement of people. We have been lucky because it happened in January, February, and the Southwest is a holiday destination. So we went into a shutdown before the holidaymakers arrived, and as a result, we've been spared an outbreak. But that doesn't mean we've been spared it forever. We've got to remain vigilant, careful, and maintain our reserves in hospitals with PPE and all those other things.
Yeah, absolutely. Maureen is asking about dentists, the new dental treatment hubs. She's saying she's worried that they won't deal with anything, that but the most serious problems. Will people suffer not being treated?
I hope not, because the National Health Service has not shut down, and I would like people to feel that if you need urgent dental care, you will get it. And I really have to give this message for all illnesses: your chest pain, your strokes, your aching toothache, your abdominal pain, we will attend to you. Of course, we're not going to do cosmetic surgery or anything like that, but please be assured, you need a dentist, you will get one.
Yeah, they've been talking about that particularly with cancer today as well, haven't they, saying, still get things checked. Joan and Richard are shielding in Bridgewater. They've heard things about UV light and placing lamps around the home. I think we heard that from America, didn't we? Would that be effective, they're saying, or a waste of time?
I think it is not a good idea to have it in an uncontrolled environment like that. So we have a special band of UV light. We call it UVC band, and it has what we call sterilizing properties, but it needs to be done by professionals who know what they're doing, because there's an amount of dosage, intensity, the right wavelength, etc. And I wouldn't go about getting these bulbs and doing it as a DIY. It can also be harmful. It may damage your skin. It may sort of give you other problems with your eyesight. So I would say don't do a DIY with your UV lights.
Yeah, okay. And avoid humans as ever, right?
Absolutely, yes.
Avoid
humans that are not in your group, and avoid humans in crowded places.
Yeah, absolutely. We always finish with that. Thank you again so very much, Dr. Bharat Pankhani. It's always a pleasure to see you. And we get so many questions for Dr. Pankhani, and then we always get this run of appreciation as well for his straightforward tone. So thank you again to those who got in contact.